Hello, I am Dr. Deb Howell with Dose of Deborah Rehab for the Heart. I am here with Harold, and Harold is a physical therapist, and he is on a journey in self-discovery, yeah? And I'm happy to have you here, Harold, today to kind of talk about, your therapy that this whole time from when you made a decision to go into therapy and all that's kind of transpired, and then this wonderful COVID experience, right? That is just bringing out all kinds of stuff in people. So welcome.
Thanks for having me.
Yeah, I'm excited. So tell me, you made a decision to go into physical therapy. And you've been, what, about 3 years, you had told me, yeah?
Yeah, 3 years. I've been doing a lot of reflecting on this recently, and all that stuff that we write on our personal statement going into PT school, I find that I go over that in my head more and more recently, like why I want to do this and the part of me that drove me to this experience. And a lot of it had to do with just wanting to be a part of the medical community and wanting to use my strengths as in the past it was just trying to promote physical fitness and a broad sense of wellness for initially my family. I was always the go-getter trying to get people to exercise. But along that pathway, I realized that there were certain components that I had to grow in myself.
Mm-hmm.
And prior to PT school, it was having a little bit of the maturity to understand what goes into being a provider and what it means to help heal other people. And I struggled massively prior to physical therapy school. Actually, I was not a great student in my undergrad because the why was missing, and I compensated for that by just always asking myself why, going through the program and getting engrossed in the biomechanics and pathomechanics, and always seeking somebody to mentor me, to tell me that, okay, this is right, this is wrong, this is how you do the job correctly. And when I got released from PT school and I started going off on my own, I was still kind of waiting for that. There were lots of components that I'm grateful for, all the learning opportunities that presented itself, but there were just some questions that I had for myself, like how do you know that what you're doing when you're palpating someone, when you're palpating a movement, that you found something that's actually abnormal or normal? How do you know that what you're doing is healing them? And then I suddenly found myself massively stepping up my patient care output and not really knowing for sure, at least for the first few months, if I was really making a difference. Although my patients would tell me all the time, "Oh, thank you," but I was always wondering, this is not exactly what we've seen in the classroom. So there was a lot of mentorship seeking for the first couple of years.
Yeah, so sort of confirmation of, do I really know what I'm doing? Because I'll tell you, part of that is like super normal, okay? That, you learn enough to get out there. But the thing about being new when you get out is to be open to continuing to learn, because there are students who graduate and then they come out, and especially coming out as a doctor of therapy, physical therapy, the open-mindedness to recognizing and also not to hold back on saying, I have questions. I really don't understand because of the credential, because of the doctor. It means that I should already know. And I think from the perspective I have when I graduated back in '94 when in the bachelor's program, okay? And I knew that once we got out, I mean, there's still so much to learn. And that transition was its own thing. And then I'm recognizing, because I went back to school for my doctorate, right, in 2015. But the students that have come out since the program is all now doctorate, I find that there's a reservation once you're out. Not so much in the clinical, not so much in the internship, right? But once you're out and you've graduated and you got your doctorate, that asking for help, you know, that maybe that would be frowned upon, possibly, right? That thought process. And then the financial piece that's also in there, tied up with an expectation that I need to get out of debt. Okay, so you have the financial piece, and then you have the actual, like, what am I doing piece, and you know, and then trying to move yourself forward. And like what you said, you're wanting to know, like, am I even, like, do I really have a full grasp of what I'm doing? And so it's not just mechanical in this way, right?
Absolutely. And what you're saying makes a lot of sense. It rings true with, I was always checking in with myself and then trying to check in with others, looking to my employers. Hey, is this right? Am I doing the right thing? And then I found that volume just kind of took over, and then it's just patient care, whether or not I was exactly sure about it, and confidence grows. But I think a part of that hunger for learning and to just kind of being taken under someone's wing came baked into my education. A lot of it was under this sense that having a lot of experience, it gives you this intuition of what is the best way to approach things, and there's no doubt about it. But I think a part of something that was missing for myself was that sense of, what is actually very valuable for your patients. It's just a way to structure it, to communicate it. And that's something that I've actually discovered along the way through some trial and error, trial by fire, and then just seeking out mentorship elsewhere.
And I think part of it, and in what and what we, and I say we because it's not a one-time thing, it's a lifetime thing as a practitioner, any practitioner, is that if you expect yourself to know, then we close off to listening, to actually hearing and assessing from a perspective that we are going to hear things that we may have like no clue about. And then, and I think one of the faults of our healthcare system is assumption, right? Assumption. We know so much, we're so expert in our field, and then we lose touch because we have lost the ability to be present, to listen, to hear what may not even be verbally being communicated, looking at body language, looking at other aspects of how we can pick up information from our patients. So that I know thing, or I think I know, I don't know, like everything around that knowing, is that what they don't teach you in school, to the degree that I feel is so foundational, is how to really, within your own being, to be present to yourself, that you can be like open and available, and the skill set, the competence for physical therapy, you take your exam, and then that says, okay, you're good enough to get out there. Good luck, do your best. And then you're like, okay, you know, but what's inside of you to feel like confident comes with time. And I think for what I'm hearing you say too is that, you know, wanting to have like this, like when you're in an internship, right, you get feedback, you have someone who's there, and then you can have conversation, you like to have that interaction about what you just did, you know, and there's some dialogue, right, with your CI. Yeah.
Yeah.
And then, but when you get out, did you feel that you could speak to your, you know, any of the colleagues or therapists that you work with, you know, that you just felt open, that I could just, you know, I have questions, and, you know, did you feel that that was something that was accessible, available to you?
Well, truth be told, when I went out on internships, I felt like the tutelage that I received was on opposing spectrums. One end was very um, there was a lot of feedback, but uh, I wouldn't go so far as to say overcoaching, but I felt intimidated on that end.
Mm-hmm.
And on the other end, I went from one internship to the next, where suddenly I was free as a bird, and I whether or not I asked a question, the answer always seemed to be, and my gut tells me that this was just from a place of them telling me, you've got this, you know what you're doing, the patients are happy with you no matter what you do. So work on that end and be confident about it. And then after that, when I come back to school, I think I just had this assumption that a lot of it is self-reflective, and I actually don't fault our academic institutions for this. I think a lot of my instructors did try to drive home the point that much of your growth is coming from a self-directed learning component, but at the same time, I do feel that what you said is very correct, that this part of the learning process is not so heavily emphasized in so many programs, that when you come out, you kind of cast that side away and you focus more on the things that you should be knowing in terms of the science, because that's technically what the doctor entails. But what I've come to learn, and learning a lot from my patients, is just how I talk to them, how I present myself, and how I listen. And sometimes I take that home with me, and that's where I felt a lot of my growth came in, and rather than understanding the presentation of certain type of dysfunction, which is still important, but remembering the person at the heart of it, that's definitely the most important part of it.
Exactly, and I think it comes back to looking at standards. Like, so you have the evidence-based stuff, right? The standard of care. So you have this condition, here's the standard, and then so you have two patients who have the same condition and they have totally different comorbidities, different personalities, different levels of functionality, all kinds of stuff. And then you got this evidence-based standard, right? So, and the way the system is set up is to streamline as much as we can, that we have some concrete information to work from. But the thing is, when we're just learning, we want that concreteness, like ground me, like in science, right? Like, that's a good place. Okay. So, but then after that, it's sort of, we need to kind of bring in the rest of the patient, you know, the rest of it. So that concrete might be a slice of the pie, right? And
Yes.
then the bigger pie, the bigger piece is going to be who is in front of you, who's there, you know, how motivated are they, right? What history have they had that would be possibly a barrier, right? And something that maybe never got addressed. And I can tell you that because And I think the beauty of our profession is that there's such versatility in how we can practice if we recognize that, being that we are looking at the physical body and functionality, movement, that, and I say this because it's things that I've learned over time with people who have complete impairment of movement, meaning they're paralyzed, they're quadriplegic, right? So we're looking at the physical body that does not move. The messages aren't getting there, right? So where are we going to look? Okay, in the book, and here's the science around this reason why the patient's quadriplegic. Great, that's great science. However, will that be the thing? Will that be the thing that's going to help that patient engage in their own process, right? Because the science can say, this is bleak, this, hey, you're never going to walk again. This is as good as it gets. And I can say, I've heard this before. And I've had patients come into the rehab. Basically, they were told by the doctor, they'll never walk again, right? This is, and then I've met so many people, not that I've worked with them specifically, that have been told, right? And it's taken them a while, but they are on their feet walking. I've had patients, though, that I have worked with that went from a quadriplegic diagnosis, impairment, to being able to walk again. So if we take it strictly from this science, hard and fast science, and then we expect that that's going to be the bigger piece, it's not. It's a slice.
Definitely.
And it's not the bigger slice, and that may possibly, think about the placebo effect, right? Those kind of things. But you as a practitioner, when you show up, and you genuinely care, that in itself, without a word coming out of your mouth, is palpable.
Absolutely.
And do they really emphasize that in school? Because yeah, we have to learn the science. We have to do that. And we have to have the skill set to do enough that we're not going to hurt anybody. We have to know the red flag, those things. But do they really emphasize that? And then even when you go into the clinicals, it is not all the same when you have different personalities as CIs. And like you said, you felt intimidated at one point, and then you felt like, okay, I'm all right. And so that's one end of the spectrum to the other end, right? What's going on in between? And I know for myself too, I had a really very unpleasant one of my clinicals, that it was very upsetting and rocked my confidence, because the CI was just, there wasn't room to ask questions, to feel that I could ask questions, and because she just, and it was her style, and then it didn't really mesh with my style of learning, you know what I mean? So those factors play into how we learn, right? So, you know what I mean?
Well, you brought up something that I feel like it's also a piece of the pie here that definitely doesn't really get touched upon. And I'd like to kind of expound on that a little bit. When you talk about how the CIs have different teaching styles and learning styles, I've seen it on both ends as a student and a CI myself. And I've known, before I branched out and did my own thing, I've known the high volume mixed payer practice very, very well. And something that I felt that you get thrown into the ring with is how to manage that, and understanding the realities of of juggling different patients with different insurance types, and where at that point in time, how you manage their plan of care and the amount of visits that you are able to allot, um, the number of visits that you are technically capitated off of, and also that you are discouraged from providing, that becomes a huge part of the conversation that also factors into the recovery, and finding ways to resolve it creatively but effectively, and then knowing when something feels wrong, that becomes a pretty big challenge. And I feel like from a CI perspective, that also factors in, and that's something that I've observed myself, that if in a high volume environment, a student can't necessarily keep pace with that, then they wouldn't necessarily be a good fit for that particular rotation. And that's something that I don't think gets addressed at all.
So you're speaking to different field experiences too, okay? Because what's on an outpatient, what's in an inpatient rehab, what's in an acute hospital setting, what's in, you know, not that people are doing home health as far as that, but it's different and different environments. And what I can tell you, because, and with different populations too, right? So you're looking at peds, you're looking at seniors, we're looking at a neuro heavy or ortho heavy, like those kind of things. So there's so many different factors. And unfortunately, what's problematic in this mix with the logistics of medical care is the insurance, right? The insurance is dictating how we do business. And, you know, ever since the managed care came into the picture, you know, things are, personally, this is only gotten worse, right? That we're basically going in, doing something, getting out, and like, let's have the best return on investment, you know, let's not hurt anybody, you know, and it has nothing to do, and everything that's written on paper, you know, this whole mission statement, to me, they're all like bogus. I will not go into my level of appreciation for to that degree, but there are a lot of wonderful things written on paper for patient experience, patient outcomes. And is it the best that we can do that is being asked of us to do, or do it, get it done in a timely manner, and to include our electronic medical records and point of service, like documentation, you know, these things happen. And then all of a sudden, your attention to detail in your note on a computer that has like lines, little lines, you know, you gotta go, and your attentiveness to your patient. I mean, these are issues, are part of the logistics, part of CI management. You want to say? It's fine. They're part of the CI management, like in the overall, like you have a student, you know, and then, but then when you're in the workforce, it's not going to change, right? So they're trying to prepare you for, here's the real world, you know, we only have X amount of time and we have this number of people to see, and the back and forth with getting paid, right? All that is the stuff, right? The stuff. And then you're just like, well, how do you feel at the end of the day? You know, how do you feel at the end of the day, and then at the end of the week, and then over a course of time? What is that? What's going on in you over time, right? And that's not only with therapy. This is our healthcare system, right? We're rotely checking boxes, moving people through, do this, do it in a timely manner. And this is a problem. But it starts from just what you're saying, you know? and just what you're experiencing when you've done, you've been on the other side as a CI to do the administration part of therapy. Did I ramble on that?
No, no, you hit it right, spot on right there.
Yeah, I have a few thoughts. But it's important because you are still fresh out. Like, this is 26 years for me, okay? And I have worked in a number of environments. So I have a good perspective of how things work on all different environments. Plus, I've been a case manager and I've been a liaison. So the healthcare business, it's a business, and it's run like a business. And the way it is today, honestly, the name healthcare doesn't measure up. It's not about health, and it's not about caring, because, you know, is it health? Is it good health? Are we promoting good health, right? And are we showing up to care, like be present to care? So those two things I find are just, they're missing. They're absolutely missing, or we need to redefine what this healthcare actually is about. So.
Well, I know you and I, we've kind of been on a pretty unique journey through some mentorship that we've received mutually. And part of that is learning how to create your own system, create
Mm-hmm.
your own environment, and find out how you can best pave a path to provide good health care and really redefine what that means. But that part of that is looking outside of what's present. That's something that it wasn't a realization for me until maybe about this time last year, when I met a lot of like-minded individuals, and it opened up my eyes to what was possible. Before then, I didn't have a bleak outlook, but I was wondering what was missing in
Mm-hmm.
a way
Is this
that,
it?
yeah,
Is this it?
yeah,
And I spent all this money and all this time for what? Like, is this it? Like, as a therapist, right? Like, I think there's a lot of those questions, like, and there's more, right? You feel like there should be more
absolutely.
in your gut. Yeah. 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 That's, now it's good that you acknowledge your gut, because there are many people who just kind of like get used to it, and they require a paycheck to get that debt and to, you know, feed their families and all these things. That this kind of stuff is this level of reckoning is not usually at the depth that you are feeling now, because it's good. It's so good that you are feeling this at this point, that, you know, there is definitely more that can be, because it takes awareness, right? It takes awareness to effect any change, right? In yourself, because you take yourself everywhere you're going to go, right?
Yes.
And so it's got to start with you. And so it's wonderful that you recognize in yourself that there is something missing. There is some desire for like more. You don't have to know necessarily what is it, but just the fact that there is this inner like gnawing almost, right? That says, before you take the nosedive and like crash, right? So we see burnout in healthcare, because people are expending energy and they don't realize that this, even though they don't address it, it's working in the background And over time, you know, this catches up, and it just side swipes folks.
Yeah, yeah. Well, the way I see it, and the way that I feel about burnout, I don't think actually hit the point of burnout when I made this realization. But what I've observed is a lot of the conversations that I have internally, they have to steer how I think when I address not only my patients but also just other peers and colleagues.
Mm-hmm.
I notice there's a lot of inner conflict just within the profession,
Mm-hmm.
and it's definitely healthy to steer clear of engaging in some online dialogue that's going on. It becomes a little toxic, but it's important to be aware of what is going on, and just even debates on our limits of practice, or how things should be done, whether it's through insurance or through cash, or the classic physical therapy versus chiropractic. I I think there's got to be this recognition in ourselves that we should always be asking what we're trying to achieve and what kind of impact we want to make. First, I honestly believe it's for ourselves first, and then for our patients. We wouldn't be caring for our patients unless if we wanted to feel good about making a difference there.
Mm-hmm.
And then using that awareness of where we are and what we want to achieve and how we communicate with each other. That's I feel like that's the way that I've personally managed to not get sick of practice, not get sick myself from working. There were times when I felt tired even in my old job, but I never hated it, because I always felt that there was always room for growth. But at the same time, there was still this gnawing feeling like, what else is there? What can I push this to? I know I'm going to plateau, and how do we move forward?
Yeah, because the thing is that, from what I have learned over time, the setup for a win-win, right? Something that will actually benefit both parties. It's not you or me, or you versus me. And the challenge with being effective in what we do is to first care about what we do, care about ourselves, care how we show up, right? And it requires, along this professional path, that we have a personal development, component, because they go hand in hand. We can be professionally heavy and be like the best. We have all these skills, for the profession, the tactics, that stuff. But then the softer skills, I guess, is that what it's called? It's not soft, man. It's powerful.
I hate that term.
I know, because there's nothing soft about it. Okay.
No.
There is nothing soft about being sensitive and vulnerable to the point where you can tune in, okay, and recognize things. There is nothing soft about that. All right. And that is the sustainable piece that we're not taught. All right. And it is actually something that requires us to choose to learn, to choose to reckon with our own feelings, right? And when we don't have a community that we feel safe to share in that space, like, and then we're trying to figure it out, and we're trying to find confirmation, and on one component, and then this other component, because it affects the other one, right? So if you're clinical competent, like that, the tactic skills, you're just like, I'm trying to get that, because, and then that's going to translate into the, like, I don't feel confident, right? So, and they go hand in hand. They go hand in hand.
Yeah.
So then you're not going to sleep well, Because if you don't feel confident, you're worrying. So, you see how this self perpetuates. And ultimately, if you as a practitioner don't feel comfortable in asking for help, and this leads into other aspects like people who, and then let's say someone gets hurt in this whole process, right? So if there's any medication involved, any other kind of, aspect of that involves your own medical care, because now there's been an injury or an illness, and then safety is the thing, right? For our patients, for ourselves. So this ultimately, if we don't take care of ourselves as practitioners, our patients are at greater risk for us making errors, right? Us missing something, and or even in as therapists, like even in the transfer, if our body is not like ready and equipped to do the movements that we need to do and have good body mechanics and just our own integrity to show up strong and in our heart, but physically, and just the capability of that's demanded of the work. I mean, this, you see that ultimately, and it's a cumulative thing, right? So it's not maybe just a one time, let's pass it off, but what if this continues over time? That the setup is not just affecting one person anymore. This ripple effect, it's pretty significant, and then it can become a very sad story. And is it preventable?
Yeah, I'm kind of floored by that. I think that expectation, we should be expected to already care. It should be implicit in wanting to go into healthcare, but I feel like that has been diluted to a point of lip service when you go through the process. I mean, going back to the origins of when you find a place to work or decide to enterprise and start your own practice, and even to the point of going into school, they ask you some of these questions, but I don't know that it's always the intent to screen for these skills or the potential for these skills and to later develop them, rather than to just kind of have some sort of screening process to basically weed out competitors. And I wish that it was seamless, but I feel like there's a disconnect there, where that ability to connect and to take care of yourself, know your why, and show up every day with that strong conviction. I don't know that it's in everyone. I'm not saying that it isn't, but I just don't know, and that's something that's a little concerning for me about this not just this profession, but I think it expanding all of healthcare.
And I think when we're young, and I, for me, I didn't go into PT school at the beginning. I had no idea what I wanted to be when I grew up. I went to the military, right, thinking, I could get out of college for a while and just kind of have adventure. And then I had so much work. I did electronics, and then I was in there, and I'm like, man, this is just not satisfying. And I thought, what's gonna make me feel like this is it? Like, and it took me a while. And even when I decided on physical therapy, my first impression of physical therapy, because of the therapist, I had broken my ankle. I was not impressed. I was just like, this is nothing. Like, this is not anything that would appeal to me, right? And I thought it was rather boring. Like, it was just nothing. It was, and so my first impression of physical therapy wasn't anything. And, but my why, because I left the military, was to make a difference, right? I wanted to make a difference, and ultimately considering physical therapy and was something that, okay, let me go for it. And honestly, it wasn't until I was actually in it to realize that, okay. And then I got, my story is interesting, but I'll wait for another time for that story. But when I actually got out of school and I went to work, what I discovered was, first of all, I think everyone should go to an acute hospital. Okay. I think it should be mandated that every therapist have an acute hospital rotation. All right. Yeah, that's my 2 pennies. All right. So, because the behind the scenes, like what I was telling you about, the folks with the physical impairment, what I learned in the acute hospital was that you cannot bring your stuff into a room. Okay. You never know who's going to be in that bed. You don't make assumptions that right? Because here's assumptions come into play. I learned a lot about assumptions from the acute rotation. And I remember as a therapist having an assistant who said things, watching her time and just kind of talking about whatever she was talking about. And her attention was really not focused on the well-being and the welfare of the patient per se. And it just turns out that that patient happened to be on the board of directors of the hospital.
Wow.
Oh my goodness. So, because when I went in there, oh my, and I had to do some damage control, and then wow, and I thought, wow, clearly this girl, she did not know, but it didn't matter that he's on the board of directors. It just so happens that his word is gonna have a significant voice here. But the thing is, we have VIP rooms, and I feel like but you ever have VIP rooms?
Yeah.
I don't want to know about VIP anything. If we don't treat every patient like they are a VIP, then you're going to miss something. You're going to make assumptions. And then if you feel that, oh, I'm going into a VIP, you might feel intimidated. Oh my gosh, like, what if I say the wrong thing? What if I, what if, and these factors are part of the experience in working in healthcare, but they play into the quality of care that we provide. And, so where do we learn this stuff? And to the degree that we need to learn it and grasp it. And I think early on, when we're young and we're just getting into something, it can be like a mountain of like, oh, that's so much. Like, I can't handle all that right now. I just want to learn how to do this and get out, and I want to help people and all this other stuff about like inner work, and I don't want to even go there, right? That's the and part of it, I think it just needs to be infused into the curriculum. The importance of self-care, the importance of self-awareness, right? This stuff is something that is not a separate thing, an extra thing to do. It's part of who we are. Who are we becoming? Who's showing up, right?
Let me play a little devil's advocate here. I fully agree with what you're saying, and building that component of self-care, self-reflection, and emphasizing it, and asking those tougher questions, doing the inner work is super important, but it can get really, really messy too.
Yeah.
And infusing that into our curriculum or even into programs as a new grad. Now, do you believe that for a lot of therapists, the the I'm going to make a word up here, practitioner maturity here. It's not emotional necessarily, because you can have very life experienced people starting out as new grads, but as practitioners, it's not just experience, but experience with reflection. That's not quite there, and our expectations of how things go will vastly differ. How do you suppose we can bring that forward to someone without a little trial by fire, and I guess do it in a sense that can not appease, but be beneficial for therapists, patients, and institutions all at once? Because I think at the end of the day, the best solution, there's some service to all parties involved on one way or the other.
Yeah, so there's this aspect of touch and being in touch, okay? And the curriculum that I went through, and maybe it's part of, I'm not sure, because I'm older. I was a mom already before I went to school. But in my program, we had an important piece that got us in touch with ourselves, right? We had practices that, like Feldenkrais, right? We did that. I learned about that way back then, you know, when I was just falling asleep in every class. I was like, what's the value of this class? Right? Because it really, there's nothing forced about inner work. We do not force inner work, because the moment you try to force inner work, barriers are up, the nervous system is on guard. Forget it. It just doesn't work like that.
It's not a off.
You're right. It's not a force, right? So the introduction to these concepts of reflection, and we can start out with what's workable. So you might ask for, if there's an experience, especially in any of the work that you're doing in class versus like going out to a clinic, is to give some opportunity for inner reflection. And I think I want to thank the class that, the disabilities class. I had a disabilities class, right? And we had to talk about, and one of our, we had to go across, I actually got to go across to a hospital that we were treating folks that were in prison. And they brought up issues of, would you provide the same care? So ethics, I feel like this weaves into ethics somehow, because the issue of, would you care for this individual, right, that had done X, Y, or Z crime? Would you provide the same care? And based on someone's prior, whether it's cultural, whether it's their own personal history, because trauma plays into this, right? Someone may have had trauma in their life, and these things, like what is the inner work can be triggering. And then is in the context of the therapy program, are they there to deal with emotional triggers? You know, you see where this can go. So we want to keep it first like a little, like plant a little seed, right? That we can start to just get some reflection on some of the things with interaction, you know, and it can start to open up, and people are like, oh, I don't like how this is feeling. I don't know if I want to do this. And if the room is made where whatever shows up is just fine. Like, if you feel uncomfortable and this is a stopping place, then respect that. You know, so it's not just like hard and fast didactic, because our profession is hard and fast. Like our profession is a lot of concreteness to it. Yet our profession has the ability to make like the most amazing impact on human beings. And it is not about the physical components. It's about the fact that we touch people, touch them, right? But we touch them in a way that reaches into their being. You know, it is the magnificence that I have found and experienced as a therapist. And that was a journey that I had to take through my own kind of crisis to figure out a way to first help myself, because I was bumping up against that thing in me that was like, is this it? Is this what I like bust my butt for? Like all the changes I made, is this it? This is not okay. Like this, and I had a lot of frustration around it, and a lot of like things that I just weren't okay. And so it was within me that I had to like work with this, and I didn't have anyone that I felt I could talk to that would appreciate what I was saying. Just kind of like, go to work, do your job, you know, like, you know, and so I just felt early on in my career, I learned this. It was within the first 5 years, and I had sustained injury, and I pulled myself out of 3 different physical therapy centers and in outpatients, because I felt that I was just being moved through, and I was actually developing an impairment. And I thought, these are my peeps. And I was being let down, and I thought, what is going on? And I was clueless, because I wasn't actually a patient in the system. And then and it was a workman's comp, I never even took time off. And I went to these places, and ultimately I had to, I was given a script to a neurosurgeon, right? Because I was losing function in my arm. And I had to call around to find a therapist who would work with me and to actually listen to me and spend time with me more than 10 minutes and just doing the thing, because the demand, just like you learned, just like you're talking about in the logistics of management, patient management, you got to see all these people. The therapist can only do so much, spend so much time, unless they're going to take that time on their end, right? And it's just like, is this care? And I almost lost my livelihood because I could not get help from my own profession. Not okay. And I did find someone, and she spent the hour with me every time, and I restored, and I didn't even need to go to the neurosurgeon, and I restored full function. So, you know, I have a gazillion stories, but the bottom line is, who are you, right? When you make a decision, and you may not understand this from the start, but I think the willingness to grow and to realize that this path is not strictly this path of being a therapist to know all the skills and get all these, you know, certificates, and then you're missing your personal, you know, this other piece that allows you to grow in your mind, open your heart, and those kind of things. And that is the factor that I know that's where you are recognizing for sure.
Yeah. Wow. I think a big takeaway from, I know we've talked about this before, but one of the biggest takeaways that I just got from hearing this again is part of this, as from the provider standpoint, is in order to dedicate yourself to care for somebody else, it's not necessarily just a function of time, but the ability to provide, lend yourself there, and doing it in a span of 10 minutes per person or 15 minutes, it's not going to be enough. It requires the ability to just attend to who's in front of you. It took you many providers to get to a point where you found somebody that would be able to spend that time to understand and listen to who you are and what you're going through and understand your experiences. And I feel that anyone who is struggling through this, and especially on the newer end of the profession, but even mid-career and finding themselves struggling, especially right now, with a lot of question marks raised about COVID and how we practice. It's a great time to just reflect on. Um, I guess one thing is, am I growing from what I do? Am I enjoying what I do? Is this fulfilling, and is this a calling? Because there are so many ways to have a livelihood and other than physical therapy. Don't get me wrong, I very much love the profession, what I do, but if it doesn't feel authentic to you, then it's going to show in the ways that you care for others. And at some point in time, if not all of your patients or many of your patients, there may be just a handful that could suffer potentially a lot from that lack of inner clarity, or they could benefit from having that massive clarity and sense of renewal every day that as a provider you take to just firm your beliefs and to constantly clarify and give yourself confidence every day and be able to live the profession and be happy going home about it.
Yeah, because at the end of the day, at the end of the week, at the end of your life, right? And I think is if we feel that we're doing something, just doing something, we're missing something. Because and I say that because, you know, the peace within in our own body, in our heart, is what are we doing with the pieces in our life, right? The pieces that we're trying to make everything fit, and ultimately to have that peace and fulfillment. And because the growth is about expansion, right? Growth is spacious. And when we're doing things that, and it also, it energizes, it fuels you, right? And the work that we can do to allow ourselves to be present to ourselves, that we're not self-judging, right? Self-criticizing, and giving ourselves opportunity to feel what we feel and resolve and dissolve and open to new experiences that are different than what we've experienced before. And this same path is the path that we offer our patients, right? To help them explore, and without their own judgment, without their fears, you know, and that inner critic that is, you know, standing by all the time. And it's important, and it's a quality that, you know, it's available when the environment feels safe, right? When the environment feels safe. And from the things that I've learned, and I love to learn because I have a high boredom, you know, it's important for me to have intrigue and in curiosity and have engagement in what I do. And so, you know, growing up, I competed. I was in sports. I play to win, and winning feels good, right? And the thing is that when the mind is telling you things that is actually setting you up to not win. Right? When really, and that mind is affecting the body, and we as therapists are working with the body, right? It's important that we're helping people to explore what is going on in them that's going to create, that's not going to set them up for success, right? The engagement, the this openness instead of like shortness. You know, you look at the physiology, you look at how you breathe when you're like stressed or when you're nervous, like everything. If you just look at physiology alone, when there's fear, when there's worry, it is not effective. You know, it's survival. The survival mode is short-lived stuff, but for the longevity of what we want to help people with and how we want to serve and how we want to feel, you know, to achieve that level of fulfillment, you know, it's ongoing. It's the marathon, right? And I saw, you know, it's wonderful that you have recognized this, and you are making decisions now to provide yourself a path and the support, right? Because it's, although we do this in our own way, it's nice to have people around us that are there. Like, you know, can't you maybe today, you know, can you just like listen to me? Don't tell me, just would you listen, you know, something, you know, having that a community and a space that will hold you in energetically in a loving way, or hold you if you need to be held, you know. So these are factors that and I know we could talk for a while, Howell. This is beautiful conversation, and it's real, and it only just skims the surface, honestly. But it's a beginning to let it be out there, you know. And this COVID crisis, I know personally, has put me in my own inner thing, and so I have some things coming out soon. You'll be seeing. But you know, how are you feeling now and moving forward? Because you have some wonderful changes coming ahead too. So it's like you're really going through some. You're in for some exponential growth. It's all beautiful though. It's all exciting.
Yeah, for your listeners, I'm an expecting dad, and that's actually going to happen exactly a month from, give or take maybe a couple of days, but a month from today. And it's a unique time to be starting a family, but I guess one thing is there's no time like now to make those changes, and no time like now to do inner work. And for me, I feel like I have no choice but to do it. But that's a blessing in itself. A lot of people have to push themselves and find excuses to get there. And for me, the motivation is automatic, and it's going to be even more so every day. I mean, aside from starting a family, there's the prospect of really getting my practice running and again and providing other sorts of value. But in all honesty, that I mean, I care about my patients and I care about what I do, but that comes a heavy secondary to my family at this point in time. It's lent a whole new perspective. And if I never get that part straight, then the ability to make decisions is a lot more challenging and a lot more questionable. Like, for example, I know we're kind of running out of time here, so I'll keep it quick. But I did walk out of a practice deal that I still don't feel amazing about, but I feel in my heart that it was the right thing to do on the when things were about to close out. I walked out at the last minute. For myself, I felt like I was questioning a lot of my personal integrity in that matter. But at the same time, I also had to bear in mind the seeds that I sow and my ability to fulfill on those ends. And no matter how many patients that I try to fulfill, if I'm not fulfilling my family, I don't think I'm ever going to do a good job of fulfilling for my patients. So that's a big lesson in itself. And I think I'll be continuously reminded moving forward. And there's a lot of learning, a lot of growth just from the process of preparing for a child. And I'm sure it's going to continue into the process of raising a child and doing all the right things for him.
Kids are great teachers. I have 4 daughters, so yeah, definitely. They teach you so much. And the thing that you allow yourself is that they teach you love. They teach you unconditional love. And it's beautiful. So there's so much ahead for you, and so excited.
Yeah.
Yeah. And that's the kind of thing, if we can go to work and feel like lifted and delighted, and that we are showing up to love our patients, like in that way, hold that right, just be there. That what occurs, because here's something I also know, is that we don't often know what we don't know, what we need to know, right? There's things that we may think we know, like especially with certain conditions or whatever, but there might be things underneath that affect that joint, right? Some things that are not actually specific to the joint. And when we're in a space of caring, I mean, this whole thing about healing is on multiple levels, So if we just stay on the outside, we're missing so much. And I think it's so perfect that, you're coming to this realization about your profession, but you're also at the same time will have a tangible, lovable source right there for you to reflect to you the possibilities, beyond what you cannot even imagine right now. I can say that with certainty. So I can. So, and I appreciate you. I appreciate your openness to have this conversation.
I appreciate the opportunity to speak on it. It's every time I get a chance to talk about it, I feel like I learned something more, and I've learned a lot from you actually. So thank you for all of your insights here and in this wonderful conversation.
Yeah, it's pretty cool. And you have a community that you just opened up, right?
I
On
do.
Facebook.
Yes.
You want to share that?
Yeah, so I call it Beyond the Clinic, Pursuing Your Higher Self. And um, a lot of it's kind of is surrounded by what we spoke about, just finding ways to grow yourself outside of earning certain didactic experiences, because a lot of that learning it goes beyond the anatomy and biomechanics, which the schools do a great job of preparing you for, but we need a guide and guideposts to help learn about ourselves. And as much as I can promote a lot of different mentors and books, at the end of the day, it's all about taking the action to really reflect upon yourself, and you're going to find ways to be your best teacher by the people you surround yourself with. So that's why I've opened up this group, to create something for anyone who's feeling like they're struggling, burning out, especially in this troubling time when you feel like your identity may be questioned as a provider, or your livelihood may be in question, or it's, I mean, just your ability to create any sort of consistent routine that's towards further development, you can always find ways to ask yourself tough questions and ask others to help you push yourself along that route.
Yeah, it's wonderful. And again, it sets for a win-win, you know?
Yeah.
It's a win-win. It feels good to feel good, you know? And it's nice as, you know, when everyone is working towards a higher, right? Something, you know, that is, it's not the intangible, right? And but it's meaningful and it's
Yes.
fulfilling. Yeah. Yeah. So, yay. We have to talk again, you know, most definitely. And I'm so happy for you and I'm excited for what's to come.
Thank you so much. And thank you for all of your insights. Really, it's amazing. And I feel blessed by having this conversation and all our prior conversations beforehand.
Well, you know, it's that whole saying, when the student is ready to teach, you will appear, that kind of thing. Like it's a timing, it's nothing forced. It's kind of like conversations happen as they need to happen, right? And folks are open, folks are not open. You know, today maybe they're open, tomorrow maybe a year, but like it is something that it is there or it's not. Simple as that. So nothing forced. So thank you for like caring and be willing to look in, you know, and love yourself, because it really is all about love.
It is. Absolutely.
Yep. So, and that little baby's gonna just love you so much. Oh goodness. Okay. So, you know, I get a little bit excited. So, but you know, it's so exciting. And gosh, I'm excited for what's to come for you, because you're on the right track. Okay.
Appreciate it.
Really. All right, Harold. You take good care, and we shall chat again. Okay.
Absolutely, we have to.
Start.